Okay, Devta.
Hello, everyone, and welcome. I am Pooja from the Prostate Wellbeing team, welcoming all of you all. I'm hoping that all of you all are in good health. Today, we are going to discuss a very important topic, which is the benign prostatic hyperplasia, which is BPH. Benign prostatic hyperplasia is the non cancerous enlargement of prostate. It usually begins in men at the age group of 50, which is obviously seen in a lot of men and can cause obstruction in the urine flow. Many men have to get up and use the restroom in the night, which is almost a troublesome ailment. In this condition, many people, and especially the patients, usually get tired as they have to urinate frequently in the night and also during the day. Sometimes, with a sense of urgency, they also need to go up and find it difficult to travel as well while attending events or even attending a movie theater cinema becomes really difficult and impossible. To throw more light on this subject today, we're going to have somebody who's very renowned, a very renowned urologist, Dr. Ajit Jena, who's an MS, MCH Urology, DIP NB Urology. He has a rich experience in handling stone management as well as treating urological problems. He's currently practicing as a consultant urologist and andrologist at the Riverine Hospital, Cuttack. Dr. Ajit Jena has a rich experience in the field of urology and carries out diagnosis and treatment with utmost precision and efficiency. He ensures that his patients' health are in safe hands. Over to you, Dr. Ajit.
Yeah,
Hello, doctor.
yeah. Good morning, good afternoon.
Hello, good afternoon, doctor. Doctor, my first question to you is कि BPH क्या है? What is really BPH?
See, before when we go to discuss about BPH, we must know what is prostate. Now, prostate is a gland peculiar to males and it is situated at the junction of the bladder and the urinary passage. And this contributes to the liquid portion of the semen.
Okay.
And peculiarly, as the age advances, like every organ of the human male, they get graying of hair, they get loosening of teeth, they get cataract. Similarly, the prostate gland enlarges. And
Okay.
it has been told that it is due to more sensitivity to female hormone. Means it is that estrogen which causes hyperplasia of this cell.
Okay. ओके डॉक्टर सो डॉक्टर हमें ये तो समझ में आ गया कि बीपीएच क्या है बट व्हाट एग्जैक्टली
And it usually happens in more than
यस डॉक्टर गो अहेड
tell me what you want to know.
राइट डॉक्टर सो वी अंडरस्टूड व्हाट इज बीपीएच लेकिन बीपीएच होता क्यों है व्हाट कॉजेस बीपीएच
See, as I said, it is because as the age advances, the testosterone level in male decreases, and at the ratio between estrogen and the testosterone it gets little disturbed, and these cells they become more sensitive to estrogen. So the prostatic cells, they undergo what is called hyperplasia, means they increase in number and size. So the prostate gland increases in size.
Okay. So, doctor, we've also heard that this happens in males who are age group of 50. So, anything that they should be careful of, क्या symptoms देखने चाहिए, कुछ उनको ध्यान में रखना चाहिए while they're looking at BPH?
See, it is a process of aging.
जी.
Like you cannot stop getting aged. You cannot stop graying of hair. You
Correct.
cannot stop loosening of teeth. So you cannot stop development of benign enlargement of the prostate also. Till date, no medicine is available to prevent the development of enlargement of prostate.
Okay. So, what can we really do, doctor, to ensure that this doesn't really happen with our main? I understood that aging nahi rok sakte hain, so we can't really completely prevent it. But what is it that they should really be careful of? Any
See,
precautions?
do is you should be aware that this can happen to anybody. Anybody above the age of 50, they can
Yeah.
get benign enlargement of the prostate.
Okay.
Now, about 25 years back, the
Mm-hmm.
only treatment for enlargement of the prostate was surgery. Now in the market, lot of drugs are available which can take care of symptoms of increased prostate. So once you know that the kind of symptoms you are having is due to enlargement of the prostate, you can start medications to make your day-to-day life comfortable.
Okay. So, doctor, you just mentioned about the symptoms. So, what are the symptoms of BPH?
See, they can have myriad of symptoms. They can have frequency of urination.
Okay.
See, there are people who may have to get up 5, 6 times at night. They
Okay.
don't get good sleep, and they obviously the functioning in the daytime in the office it suffers. There are
Right.
people who get urgency. Means suppose you are traveling by a car or a bus, and you have a desire to pass urine, you cannot hold it,
Yeah.
then it becomes a problem. Like you
True.
will have to ask the bus fellow to stop in between, which they don't want to do, but you cannot hold your urine. So
Yeah.
that can also happen. Sometimes you may pass blood in the urine.
Okay.
Sometimes this prostate it causes retention of urine, means you are not able to evacuate your bladder completely. So you
Okay.
can get recurrent urinary tract infection. Sometimes you may develop acute retention of urine, means you may stop passing urine, which is a very painful condition. And if it happens suppose you are in a busy schedule, or you are engaged with some family activities, at that time you stop passing urine, it becomes a problem for the whole family. Another
Absolutely.
thing is a chronic retention of urine, means without your knowledge you may stop passing urine completely and retain a large amount of urine in the bladder, which can produce retrograde effect on the kidneys may get swollen up, and it may lead to the chronic kidney disease also. And
Okay.
you can get also recurrent urinary tract infection. All those things can happen.
Okay. So, doctor, imagine if there is a patient who suddenly started suffering, as you said, recurrent UTI and many other issues related to urine. Are there any specific tests that they need to undergo immediately when they feel that there is something like this happening with them?
See, the most important and probably the best procedure to diagnose that
Mm-hmm.
there is an enlargement of the prostate is abdominal ultrasound examination. On
Okay.
ultrasound, if we see that prostate is enlarged and the bladder is thickened, means it is passing urine under constraint. And
Okay.
at the end of voiding, means passing urine, there
Yeah.
is some retained urine in the bladder.
Yeah.
Then it obviously it points that there is residual urine in the bladder, and that person is getting urinary tract infection. And if you don't bring down the residual urine level
Mhm.
to a very substantially low level, then the infection will never subside completely. You will need a very prolonged treatment, and that treatment also may not be successful.
Okay. Okay. So, doctor, what I understand is the moment a viewer, from a viewer's perspective, if they are experiencing something related to their urine or urinary tract, they need to go immediately to a urologist or any specific doctor that they should be visiting. And then obviously those tests get prescribed.
See, anybody having urinary symptoms, they must go to an urologist only, because
Okay.
no other person
Yes.
other than urologist understands your bladder better than a urologist.
Absolutely. So, my viewers, please take a note of it. You're experiencing any issues with urine, urinary tract infection, anything that you're confused with and has got to do with your bladder, please visit a urologist. That's the only space where you can get the right treatment. So, doctor, we spoke about the symptoms, but any specific troublesome symptoms that you want to highlight? While I did understand a lot that you mentioned about, having blood also in urine found and many other such, but anything that you want to highlight, doctor, specific to the symptoms?
See, sometimes this frequency may
Mm-hmm.
be incapacitating.
Yep.
Like if you are, I met an senior government officer
Mm-hmm.
who was not able to be in a meeting for more than half an hour. He was supposed to be the topmost officer in the state. Now
Yeah.
he said, Doctor, if he cannot hold a meeting for more than half an hour, then how can be I be in the topmost post in the state? So
Yes.
the frequency itself is a big problem. See,
Yes.
other problems you can somehow manage, but
Yeah.
frequency is a very worrisome and troublesome symptoms, and you should be very careful about.
Clearly. So, health is vital, and we understand even the frequency itself shouldn't be ignored. Don't wait for this to really get alarming for you. Take care and ensure that you reach out to your doctors in time. So, doctor, very well pointed out with the troublesome symptoms, but we want you to elaborate a bit more on the treatment aspect. Imagine they've already found out from the doctors and the tests that they do have BPH. Now, what is the line of treatment?
Now, if you are diagnosed with a BPH, now to put diagnosis of BPH, you
Hmm.
must always rule out that there is no cancer in that prostate. So you
Okay.
should have serum PSA done, serum prostate specific antigen in all patients who
Okay.
have got enlargement of the prostate. And
Okay.
if the prostate specific antigen is within normal limit, now you treat the patient as an benign hyperplasia of the prostate. Now, as I said earlier, about 25 years back, there was almost no medicine to treat benign enlargement of the prostate. Now, we were asking people to wait, and wait. When the symptoms become very severe or the person is not able to manage with the symptoms, then we used to ask them to go for surgery. Now, a wide variety of drugs are available to improve the symptoms of the prostate.
Yeah.
Now, these drugs can be divided into two, three groups. Number one, they are known as alpha blockers. Alpha blockers means there is a kind of receptor that is rich in the bladder neck area, and these receptors are blocked by some drugs, what is called tamsulosin hydrochloride and silodosin hydrochloride. These drugs are available. Now,
Okay.
what they do, they relax the smooth muscle of the bladder neck area. So
Hmm.
earlier, because of the prostate, that obstructed area used to get a little relaxed. The
Yeah.
spasm used to go down. So
Mhm.
urine flow becomes smooth. And there
Okay.
are people who have been managed with these alpha blockers alone for their whole life, and they never needed any surgery. Now, besides the relaxation of the epithelium of the bladder neck, there is another group of drug which reduces the mass of the prostate. They are known as alpha 5 alpha reductase inhibitors. Means they inhibit an enzyme in the prostate which prevents the muscle hyperplasia. The size of the prostate in some cases, about 30-40% of the cases, they may regress also. So the
Okay.
urinary flow becomes better. If somebody has got more than 30 grams of prostate, he should be put on 5 alpha reductase inhibitors like finasteride, dutasteride, so that the volume of the prostate also sinks. Now, lately, for last 10 years, prostate is being treated with this 5 phosphodiesterase inhibitors. That is
Okay.
known as uh, tadalafil. Now, this tadalafil, it reduces the inflammation of the prostate gland and it can cause improvement of symptoms. So all these drugs are available, but and fortunately we can give these drugs together also, and given together they produce much better effect than each of the drugs given alone. When the prostate is less than 30 grams in size, they need only alpha blocker. When the prostate is more than 30 grams in size, 40 grams, 50 grams, 70 grams, they need alpha blocker and this dutasteride also. And in all these cases, these things, our 5-phosphodiesterase inhibitor, that works. That also works. And besides these things, prostate, the frequency, they get frequency. To reduce frequency, their
Yeah.
smooth muscle of the bladder has to be taken care. Now,
Okay.
these smooth muscles of the bladder, they are treated with two kinds of drugs. One is this anticholinergic drug, that is, they relaxes the bladder muscle, and another is these beta 3 stimulators. So these drugs are also available in the market. They are easily available. They come from different reputed companies and they work well. They are very safe. You can take them for years together also. And the frequency part is taken care of by them.
Okay. Okay. So, thank you, doctor, for highlighting varied types of treatments that are available for BPH. Doctor, we do have some questions coming in from our viewers, and I'd like to take one of the questions, which is from Mr. Arvindra. It says, how does BPH really affect the size of a prostate?
Size of the prostate means, see, actually, I could not follow your question. Can
Mhm.
you please repeat it?
Yes, so he's written, does BPH really affect the size of the prostate, as we were talking about prostate
Yeah.
enlargement or stuff? So, does it
BPH
really affect?
BPH increases the size of the prostate. Sometimes the prostate can be as large as 200 grams to 250 grams. But the voiding dysfunction is not dependent on the size of the prostate. Somebody can have a very small prostate with
Mhm.
severe urinary symptoms, and
Yeah.
somebody can have a very large prostate
Yeah.
without significant urinary symptoms. Imagine a small stream. If you the small stream sometimes can block by the dried leaves, but a same stream, if you put a huge rock on it and that rock has not fit into that stream, it is above the stream, the urine will flow, the water will flow beneath that. So the
Okay.
size of the prostate has got no relation with the
Yeah.
kind of symptoms it can produce.
Clearly. I hope we've answered the question for Mr. Arvinder. Doctor, there are two follow up questions from two people, from Mr. Rahul and Raju. Their question is, which organ is really affected by BPH and does it really affect the urine flow?
Yes, see, the BPH affects the prostate gland,
Okay.
and prostate gland is very much required for procreation. It is
Correct.
only present in males, and it is only important for young people. But
Yeah.
as the age advances, the
Hmm.
reproductive requirement of a male is much less. So then it becomes a liability. So it produces symptoms and other things.
Doctor, you just mentioned about the sexual ability and stuff, and there's a question that's coming from Mr. Arush, and it says, "How does BPH really affect a sexual function for a male?"
See, BPH actually, they say that at some stage, some people may reduce their sexual drive and all that, but per se, it doesn't affect much. But if you operate on prostate, these
Okay.
people, they will not have ejaculation because this BPH is encircled the part of the bladder which closes during ejaculation. So if you remove a prostate or do surgery for the prostate, then the person post surgery will have dry ejaculation.
Okay. Doctor, I had a personal question coming up in my mind that you mentioned that prostate usually happens post the age of 50. So, does that mean that our youngsters don't need to really worry about it, or do they need to do anything during their young days to ensure that at the age of 50 they're not really affected with this condition as much as it could?
See, I have seen people who having retention of urine at the age of 42 also.
Yeah.
At 42, they had enlarged prostate and retention of urine. But
Yeah.
that is maybe in a 40 years career, I have
Hmm.
seen cases like that, maybe two, three. So they are not very common. They are unusual. But
Mm-hmm.
nobody should take it granted that because they are 40, they cannot have retention of urine due to enlarged prostate. By and large, it happens after 50. And now that the longevity of Indian people also has goes up, what I used to see in the beginning of my career,
Yeah.
nowadays people only when they are nearing 70, they have BPH symptoms.
Yeah. Yeah. So, Doctor, you have most of our questions answered that have come in from our viewers, but anything else that you want to highlight about this subject for all our viewers to benefit from? I'm sure we covered a lot about the symptoms, the causes, but anything else that you want to highlight about this subject?
Now, see, the most important and curative treatment for
Hmm.
BPH is surgery.
Yeah.
Now, the surgery is mostly the basic surgery for enlargement of the prostate is endoscopic. And BPS surgery is probably one of the oldest endoscopic surgery available to mankind. It is
Hmm.
being done all over the world for last 60, 70 years. And in this, what this is known as transurethral resection of the prostate. This is a very common procedure, and it is done where the surgeon puts an endoscope into your bladder, visualizes your prostate with the help of a camera, and resect that prostate with monopolar or bipolar electric current. But the problem with this procedure is here you are removing only the enlarged portion of the prostate. Sometimes the surgeon fails to notice that he has left behind a sizable portion of the prostate, especially when the gland is more than 70, 80, 90 grams. In that case, nowadays, again, laser enucleation of the prostate is done. Now, in laser, different kinds of lasers are available. We don't have scope to discuss about that here, but here again, like olden days, the whole prostate, enlarged portion of the prostate is removed, no remnant is left behind, and in this, bleeding is relatively less than the endoscopic surgery. Now, recently, another surgery also has come that is known as resume. Here, air vapor is injected into the prostate in high pressure with a needle, and that again vaporizes the prostate completely. Here, anesthesia is not given at all. Now, why in surgery of the prostate, anesthesia is an important factor because it happens only to elderly people. Nowadays, diabetes, hypertension, heart disease, they have been very common. And when a person has got enlarged prostate and he is 70 plus, he has all these comorbid conditions. So there is a very intense search for some procedure which will remove this prostate. At the same time, he will not affect his comorbid conditions. There is another procedure has come recently known as Eurolift, where again, in a very local procedure only, they put two, three clips in the prostate and they create a passage. So all these procedures are under uh, what you called survey, that how much they will be effective in the long run. But basically, transurethral dissection of the prostate is a gold standard for treatment of benign enlargement of the prostate, and the patient is compromised.
Yeah.
Comorbid conditions are a lot. Then, of course, he can have an enucleation of the prostate with a laser.
Okay. Okay. So, doctor, just before we conclude, one last personal question that I had is: any post-surgery care that we need our patients to undergo? Understanding that they're very elderly patients who have to undergo this.
Yeah, yeah. This urinary passage here, you will have to manage in a, for males. It is a almost even less than 1 centimeter in diameter, or maybe zero point 0.8 millimeter in diameter, a passage through which you will have to put all instruments and everything, remove that enlarged prostate. So post-operatively, you may develop urinary passage narrowing, which can again produce symptoms like prostates. You can develop what you call unhealthy healing of the prostatic area where you had resection. Some people can have intense bleeding following surgery. But since these procedures are being done for a very long time, now it is almost streamlined. The complication rate will be less than 5%.
Okay. Okay. So thank you very much, Dr. Ajit. I think this has really, really been a beneficial and a very important session for most of our viewers. And I'd really want to say that early diagnosis can only help you to lead to early care and early treatment. Thank you very much once again, Dr. Ajit Jena,
Thank
for
you.
your valuable time and helping us really understand this subject in depth. And I'm sure our viewers would have benefited a lot in understanding about BPH and ensuring that they can cure this ailment if they're really facing something like that. Thank you very much, all the viewers, for your excellent participation and the questions that you shared. For more information and updates, stay connected on our FB page called Prostate Wellbeing. We're also available on YouTube, Twitter, and Instagram. Thank you very much and have a great day, everyone.